Once a parent learns that their child has been admitted in the NICU, it creates fear of having an early unexpected birth of the baby that has been hospitalized. The NICU environment creates overwhelming emotions. The parent feels dysregulated about seeing the medical equipment that is being used, the wires that are going through their baby, the uncertainty of the health outcome and survival of their baby, which creates a lot of anxiety, depression, and post-traumatic stress, especially for parents who have had traumatic experiences of complicated childbirth. And therefore calling upon us, healthcare providers, to provide psychosocial support to these parents that have babies in the NICU. And how can we do this as healthcare providers? So one, communication between parents and staff is very important. I know many of us can talk, but I must emphasize that rarely do we communicate, and therefore we need to communicate in a healthy and an attentive manner so that parents feel they are not a burden. Their issues, their concerns are being addressed. They understand what is going on in terms of the treatment, even the duration that they are going to spend in hospital, and more so even the financial aspects that come in, because this can also heighten the distress that the parent presents with in the NICU. And the information given should be sieved depending on the responsiveness of the parent that you are communicating to. Secondly, educate the parents about caring for their child. For example, diapering the baby, the different modes of feeding. Is it the NG tube? Is it the breastfeeding? How do they do this? It helps them to receive all this training, and also it helps the parents to be able to deal with the anxiety, especially when they fear to touch their babies because of the size, the appearance of the baby, which is worrying. So engaging helps them to cope and emotionally deal with the distress that they have. Otherwise, if it's not done, they feel lonely, they feel abandoned, they feel left out, and they feel they are not part. And this can affect their bonding and attachment with the baby. Thirdly, as healthcare providers, it's also important not to outlive ourselves in acquiring knowledge and skills related to mental health issues. This helps us to be able to identify those with symptoms that require immediate attention. Fourth, continually communicate to the parent. It helps them to be able to cope even when you had communicated to them in the first instance. Daily communication is very important for them to be able to cope, because anxiety is provoked and triggered by anything, anytime. The long duration, the isolation, the baby's evolving health condition. So there is need to continually communicate to the parent. Then also transitioning from the NICU to now home to the discharge can also create a state of panic in the parent. We need to inform our parents about that time when they will need to transition and be prepared for the discharge. Many times they may present with anxiety of how they are going to be able to cope and access healthcare providers in their own home settings. Inform them that healthcare facilities are available and they can be able to check in and receive care for their babies, and more so return for review. The date should be communicated to them when that time surfaces, the date of review, where and where they can continue to get the health care for their babies. It helps them to know that they are not abandoned, there is continuity in care. Then also, parents need to understand that there is continuity of care, especially when there is a changeover in shifts. They need to be able to feel that this is the same person, though physically different, but this person is providing the same care. Handovers should be done adequately so that the person coming in the next shift can pass on the same information and provide the same and adequate care to the baby that is in the NICU. Then lastly, many times some will complain of sleep disturbances, lack of appetite. Encourage them to sleep, even if they are 10 to 15 minutes. It helps them to be more productive and it rejuvenates them to be able to care for the baby and even themselves more so. To hydrate, to take plenty of fluids, and also, much as they do not have the appetite, but to ensure that they eat. Some will feel they don't need people to know that they have given birth to a preterm baby, that their baby is in the NICU. Encourage them to establish those social connections as they help them to be able to deal and manage themselves. Then also, importantly, I encourage healthcare providers to establish and institute safe places in their units where group discussions, individual discussions can take place among parents, where they can ably feel comfortable to open up about issues concerning their stay in the hospital or even other issues that may be disturbing them or making it difficult for them to cope while in the NICU. One other bonus point, refer. As healthcare providers, refer these parents that you identify have post-mood and anxiety problems. This will help the parents to ably cope and function better in dealing with themselves as well as in the care and engagement of their babies. Thank you very much.